apart from just beetroot supplements, people look to consume things such as L-arginine or L-citrulline. But you haven't mentioned about these compounds. Are they useful? They do have some role in the function of nitric oxide synthase, correct?
Well, they do, but these are semi-essential amino acids. First of all, citrulline is a byproduct of nitric oxide production. Arginine undergoes a 5-electron oxidation to produce nitric oxide, and citrulline is a byproduct. And there's never a deficiency of arginine. And in fact, taking products that have excess arginine or giving extra arginine has been shown in clinical trials to increase mortality in post-infarct patients and to make patients with peripheral artery disease worse, increase intermittent claudication, and patient outcomes get worse. So there's never a deficiency of amino acids, arginine, for production of nitric oxide. And biochemically, the binding constant, what we call the Michaelis constant in biochemistry, for arginine binding to the NOS enzyme is 5 micromolar. And even in the sickest of sickest patients, and you know this as a physician, intracellular and plasma levels of arginine are 100 to 200 micromolar, 20 to 40 times higher than what's needed to theoretically saturate the binding site of the NOS enzyme. So arginine and citrulline are useless, and yet there's hundreds of products on the market out there that put these amino acids in a package and call it a nitric oxide product. And if you don't know what you're doing, you can actually cause more harm than good. So now arginine and citrulline products are completely useless in terms of nitric oxide. The body makes enough to saturate the enzyme, and it controls its own metabolic shuttling of arginine through the nitric oxide synthase enzyme. It doesn't use extracellular arginine.
Right. We talked about consuming nitrates, but over the past few decades, there was a huge stigma regarding potential cancer, especially colon cancer, if I remember, with nitrate consumption.
Yeah.
Have you looked into this?
Oh yeah, we've dealt with this for the past 30 years, and in fact, we've completely debunked this myth. So it started in the 1950s, where it was first recognized that people who consumed cured and processed meats had a higher, what we call relative risk index for certain cancers, primarily gastric cancers or GI cancers. So and this is nutritional epidemiology, so that's called an association, but not causation. So to elicit a causation, there has to be a biologically plausible mechanism to account for that observation or association. So in the 70s, people thought, well, it's nitrite and nitrate that form nitrosamines, and nitrosamines are carcinogenic, cancer-causing agents. So cured and processed meats that have nitrite form nitrosamines cause cancer. Well, now, since 2000, the National Toxicology Program did a dose escalation study and found no evidence of carcinogenicity by nitrite or nitrate in really huge doses. So that whole biologically plausible mechanism fell apart. And the other thing that we observed over the past 20 years is that if nitrite and nitrate cause cancer, vegetarians would have a 10-time higher cancer rate than meat eaters. And we know it's just the opposite, because 85% of the nitrate and nitrite that we get from our diet comes from green leafy vegetables. Only 5% comes from cured and processed meats, and the other 10% comes from swallowing our own saliva from the endogenous production of nitrite and nitrate from the oxidation of nitric oxide. So now we know that that's not, in fact, not the cause of cancer. There are other things in cured and processed meats like heterocyclic amines and things that may be mutagenic or carcinogenic, but it's not the nitrite and nitrate. In fact, we and others have published that they have anti-cancer effects. In fact, that's the reason people who eat a plant-based diet have lower incidence of cancer, heart attack, and stroke because of the nitrate and nitrite. Yep.
Have you noticed an overdose potential, or what if somebody gets, we know in medicine in a way that you can significantly drop your blood pressure.
Sure.
That does happen if you are on substances such as Imdor or similar nitrates for blood pressure or heart disease, and you take Viagra, for example, and it can seriously drop your blood pressures. So any contraindications, any things to watch out for that you've noticed in your trials and studies?
Well, there's only two causes of toxicity for nitric oxide and nitric oxide-related molecules. It's hypotension, so an unsafe drop in blood pressure, and then the other is methemoglobinemia. So if you take too much, it'll oxidize the
nitric
iron.
oxide has been the worst, I believe, if I remember, has been the worst culprit with that, right?
Yeah, so nitric oxide is used in hypertensive crises, and if you overdose it, you can cause methemoglobin formation and cyanosis and actually kill patients. But But so at the doses that we deliver, we haven't ever seen an unsafe drop in blood pressure, and we certainly haven't ever seen any MET formation. In fact, the pediatric patient we were treating with the rare genetic disorder, we monitored him every hour for MET formation, and even taken one lozenge every 4 to 5 hours, we never saw even an uptick in any level of MET hemoglobin formation.
Right. So this is amazing. And of course, the ongoing research into nitric oxide is not just groundbreaking. It has the potential to, revolutionize how we approach healthcare. And by understanding and harnessing the power of this molecule, I mean, we can open doors to new treatments and preventive measures, for a wide range of diseases
well, that's our
that
goal.
are just considered, they're just considered inevitable aspects of aging. And I'm surely excited about this. Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.